The next presenter will be from the Ontario Medical Association, Dr. Sarah Newbery.
Thank you very much. I'll just check and make sure you can hear me. Great. So my name is Sarah Newbery, and I'm a rural generalist family physician here in Marathon in the traditional territory of Big Dugong First Nation in Northwestern Ontario. I'm a member of the Ontario Medical Association and also Associate Dean of Physician Workforce Strategy with the Northern Ontario School of Medicine. I really appreciate the opportunity to present to the committee today as the government deliberates its budget for 2022. I want to thank the government for all that you are doing, but recognize that there is much more that we need to do in healthcare. Healthcare spending must be prioritized, especially in Northern Ontario, where our situation is quite dire. We need to improve access to care and urgently address the shortage of physicians, both family physicians and specialists across the North. Ontario's physicians are eager to work with all levels of government, community leaders, and healthcare stakeholders to provide the care that patients need. At last estimate, just under 84% of citizens in Northwestern Ontario reported having a primary care provider, and that is well below the Ontario average of 94%. Life expectancy in the North is 2.5 to 3 years less than the Ontario average. And we know that Northern Ontario as a whole is short 325 physicians, family physicians, internists, pediatricians, psychiatrists, anesthetists, and several subspecialists. 325 physicians is 5 entire NOSM classes, but we can't wait 5 years for those physicians. We need them now. Between December of 2020 and June of 2021, in that 6-month span, we lost 11 rural generalist physicians from Northern Ontario, bringing the total rural physicians that we need to 97. Northern doctors are working really hard in quite difficult circumstances now, managing complex patients. In addition to the work that we have always done in clinics, hospitals, long-term care, and patients' homes, we are also now managing assessment centers supporting the vaccination effort and leading local health systems to provide safe care during COVID-19. Prior to COVID, we knew that the North was underserviced, but now many patients live with the almost daily threat of emerge department closures, which means no way to access local emergency care. If, for example, the emerge department in Wawa closes, it's 2 hours to the next nearest emerge department. If you're in Red Lake, it's 3 hours to the next nearest emerge department. And that time is a matter of life and death for someone who is having a heart attack or stroke or rapidly deteriorating COVID-19 illness. In my own community of Marathon over the holidays, in addition to all the other work that we did, we resuscitated and placed on life support 3 people who needed to be transferred by Orange to Thunder Bay Regional Intensive Care Unit. Those people would have died on those days had our emerge department been closed. Without physicians in rural communities in the North, there is no emergency service as we know it. But it's not just the emerge that matters. The North was disproportionately affected by mental health and addiction challenges prior to the pandemic, and that situation has worsened significantly. We need better access to mental health service all across the North. We know from our hospital sector that the North is short 40 psychiatrists. We hear every day from family physicians and pediatricians who were overworked prior to the pandemic that they are now overwhelmed with the demand for mental health services. Every day for almost 2 years, the province's 43,000 physicians have seen our healthcare system stumble under the weight of the COVID-19 pandemic. The negative impact on patients is incalculable, and it will take years to catch up. That's why last year, the OMA undertook the largest stakeholder and public consultation in its 140-year history to understand how to address the most urgent challenges. That 8-month consultation began here in Northern Ontario, and it included Northern Ontario leaders from many sectors, including extensive input from Northern physicians. The result is Prescription for Ontario, the doctor's 5-point plan for better healthcare, and that launched in Sudbury in October. It comes down to 5 priorities: reducing wait times and the backlog of care, expanding mental health and addictions programs, improving and expanding home and community care, strengthening public health and pandemic preparedness, and giving every patient a team of healthcare providers that are linked digitally. To fix the shortage of physicians and healthcare providers in the North, the OMA also recommends that we focus on the vision of equitable access to care for all patients in their communities, that we review and update incentives and supports for physicians and other healthcare professionals in the North, that we increase our focus on education, training, innovation, and opportunities for collaborative care in rural and remote communities, that we create more opportunities for specialist and subspecialist trainees to do electives and core rotations in their training here, and that we create more opportunities for medical students and residents to develop the skills that they need to confidently choose rural and remote practice here in Northern Ontario. So again, we need 325 physicians. We are short 325 right now. We need to build on NOSM's success and expand NOSM's undergraduate and postgraduate programs to ensure that we train the physicians that we need. We also know that 1 in 5 postgraduate trainees from other programs who come to the North to do an elective will return to work here, and that's a high return on investment. We need to support the new rural generalist pathway so that more medical students and residents can train to confidently enter practice in rural and remote Northern Ontario. And we need to have attractive and meaningful contracts that will encourage new doctors to come and to stay in Northern Ontario. We need to actively work to retain all of our current clinicians, both for clinical care, but also to teach our future physicians. And as we recover from COVID-19, we need to ensure that we apply our full capacity to address the backlog of care. We need every rural hospital fully functioning, and we need every clinician actively engaged. The pandemic has proven that we cannot have a strong and sustained economy without a robust healthcare system. One of the first questions that businesses and professionals ask when they're thinking of moving to the North is, what is the healthcare like there, and can I get a family physician? A strong healthcare system here will help to attract new businesses, residents, and investment, bringing opportunities for youth across the North and making it easier for our elderly to age where they have lived. A healthy and vibrant North requires equitable access to a strong and resilient Northern health system for all of our citizens. Thank you for the opportunity to present today.
Thank you very much for the presentation. Our next presenter is Grant Church.